unlikely to even return to school or get re-enrolled in school because they've missed many months of school. So catching up becomes a burden. And for those who are able to re-enter in school after such long gaps due to the search for pasture and water, then they start lagging behind. And this also causes like other issues around disinterest in education. And therefore, the likelihood of them even completing primary schools is very small. And then we also see that in this kind of pastoralist settings, unpaid care work reinforces cultural norms and potentially influences life choices, especially around early marriage and early pregnancy. So what we've seen, for example, in our work in Wajir, is that the more the burdened the girl becomes, the more the responsibility falls on the girls. For example, if they've been selected to be the ones to take care of the animals on behalf of their family, then they opt to get married because they feel that early marriage gives them a better life than staying at their home and having to look after animals. So it definitely influences their life choices around early marriage and also consequently early pregnancy. So the weight of this unseen labor can limit their academic performance and education opportunities. But beyond just education, they might also have very severe negative impacts on their general well-being. So in Wajir, we've been implementing this program called the Adolescent Girls Initiative Kenya program. So this was a randomized controlled trial that we started implementing in 2015 that was targeting young adolescents 11 to 15 years. And the whole rationale of implementing it was to look at the long-term impact of intervention and particularly of multi-level and multi-sectoral interventions on the lives of adolescents, and also to look at what the long-term impacts of investing programs early on in life before irreversible consequences, for example, like early marriage and early pregnancy occur, is. So we conducted the first 6 years of this program, and we for this particular phase, we wanted to really understand what the short-term and mid-term impacts of the programs we were intervening in were. And then we also did another follow-up of the same cohort of people in 2021, and just to start understanding what the longer-term impacts of that intervention we were implementing were. And then based on the results we were seeing from this randomized control trial, we were very encouraged, and we started like engaging the county government in Wajir just to do some sort of like testing for scale up, which we just completed last year, and are now moving into full scale up for the interventions that I'll be presenting shortly. And the main purpose of just testing for scale up was just to look at what the cost vis-a-vis government structures would look like for this kind of interventions. So these were the interventions that we were implementing and testing. So we implemented in about 80 villages in Wajir. And because it was a randomized control trial, we clustered the interventions into 4 categories. So the first intervention arm was what we called community engagement. And this was basically an intervention where at the village level, different kind of stakeholders could come to discuss the value of girls' education, to discuss issues around the negative gender norms that are impacting adolescents in their community, but more importantly, also to come up with solutions to whatever challenges they were identifying as a community. So they would meet on a monthly basis. They would have facilitated sessions. They would be guided through a trained mentor would guide them through like developing solutions for the challenges they were identifying. And these interventions took about 2 years, so between 2015 and 2017. And then the second combination of intervention was on top of the community engagement, we delivered education cash transfers. And these cash transfers were conditioned on enrollment and attendance for school-going adolescents. So if, for example, girls would get enrolled in school and attend 80% of the school time, for that term, then they would be eligible for a cash transfer that went directly to the household, but also the girls would be eligible for other kinds of dignity kits. For example, the schools would also receive an incentive to be able to keep and encourage the girls to stay in school. And then the third intervention was on top of the two, that is the community engagement and education cash transfer, we added on health and life skills. So these were delivered through safe spaces sessions by a trained mentor through a standardized curriculum. So a lot of topics around reproductive health and life skills were taught over a period of 2 years for both in-school and out-of-school girls. And then for the fourth intervention, it was a combination of the three, but on top of that, there was a wealth creation component, which basically was also run through a safe spaces model, and the young girls were taken through financial literacy, building of financial literacy and wealth skills. So what we really wanted to learn was what multi-sectoral and multi-level interventions have impact for adolescent girls. And because we acknowledge that the girl is not an island, they live in a household, they live in a community, the household and the community influence their choices, influence their opportunities in life. So we really wanted to understand if we implemented multi-level kind of interventions that were multi-sectoral, which one of them would be having the greatest impact, for example, towards the girl's life. And then we also wanted to understand whether early interventions can improve longer-term outcomes for adolescent girls in such a setting. So just to cut the story short, we did, because it was a randomized control trial, the intervention in itself was implemented between 2015 and 2017. But what happened was, before the intervention was implemented in 2015, we conducted a baseline study. And then in 2017, we conducted another round of data collection. In 2019, we collected data with the same girls. In 2021, we collected data with the same girls. And what we were seeing was very consistent in those years from the results of the RCT, because even in 2021, which was 4 years after the program had stopped being intervened, is when we compared the girls in the first arm, or in the villages where we only implemented the community conversation groups or community engagement groups, vis-a-vis these other arms that had the education cash transfer, the health and life skills, and the wealth creation component. We saw that those girls who had been out of school when we started in 2015, when compared to the ones in the other arms, were doing better in terms of having higher rates of school enrollment, also having decreases in early marriage, and also being less likely to be early married and before the ages of 18, and also having like early pregnancy. And therefore, the results were very, very consistent when we looked at the short-term impacts in 2017, the mid-term impacts in 2019, and the long-term impacts 4 years after the program ended. And that's why we started discussions with the county government and tried to do the testing for scale-up phase that we've just completed, and we are seeing very, very similar results. So in terms of unpaid care work, we did not, the whole program was not geared towards like looking for interventions around the burden of unpaid care work, but was more geared towards understanding what kind of interventions really can lead to reductions in child marriage and early pregnancy for a context like Wajir. But we used that data just to look at what have been the impacts of the burden of unpaid care work on this kind of girls. And we looked at data from 2021, but also from 2019, from the 2019 study we did, and the results are very similar. So by 2021, these girls were about 18 years old because when we started, they were around 11 to 14. And by 2021, when we were conducting this study, among the ones who reported burden of unpaid care work, 60% of them were attending school at that point. So what we saw was that about 71% of these girls spent at least more than 2 hours every day to perform household care work. And this meant that when they come from school, they had to spend at least 2 hours and above to be able to support in other kind of household responsibilities. So we tried to understand like what would have been the impact of this. Like, were there any relationships with other indicators around the amount of time that was spent doing household chores? And what we saw in 2019 and 2021 was very interesting because we saw that the girls who spent more household chores were more likely to not have completed primary school, were also having lower numeracy scores, and were also more likely to be the ones that had ever been pregnant, and were also more likely to be the ones that had ever been married before the ages of 18. So basically, these results were from the 2021 findings, but were very, very similar to what we had seen from the 2019 findings. But additionally, in the 2019, we also saw that the adolescent girls who were doing more unpaid household chores were also more likely to have lower financial literacy scores, and also were more likely to be out of school, and also have lower literacy scores as well. So these findings are very, very critical for us because it's good to start unpacking what kind of negative impacts unpaid care chores can have on adolescents' lives. So what we normally see is findings around the implication of unpaid care chores on education, and that's very, very clear and very well documented. But just to bring to light that there are other kind of negative impacts just beyond the education indicators, which include early pregnancy and early marriage for such a context. So we need to understand the impact of unpaid care chores, especially for young people, just because we have to start these debates, we have to start the conversations around how do we challenge the social norms and gender stereotypes that undervalue particularly girls in this kind of pastoralist community. How do we make the policies or design policies and programs that are really supportive of them in this kind of settings, but also how do we shorten the time this kind of work takes away from their education, and how do we balance that? How can adolescents be helped to redistribute unpaid care work? And in contexts like Wajir, where gender norms and culture really play a big role in shaping the lives of adolescents and particularly girls, what are some of those interventions or solutions that can be leveraged on or implemented to be able to help them overcome the burden of unpaid care work? So in terms of opportunities for policy, we think that girls' education is very important. And for this kind of context, there's need to do a lot of work around raising awareness on the value of girls' education, and also educating communities around how too much housework can detract from girls' schooling, particularly. But also a lot of work is needed on norms change, especially that is supportive of deconstructing norms that negatively affect girls, and also trying to look at, for example, what are the kind of programs or supportive programs that could be able to help girls be able to have more time to do their schooling, for example. And from our model in the Adolescent Girls Initiative Kenya, we saw that the safe spaces models were really impactful in so many ways and really transformed the lives of girls in this kind of settings in so many ways. And we think these are the kind of programs that could be leveraged on to create a place for girls to do their homework before they go home, so that when they get home, and their focus is shifted to doing household chores, then at least they will already have had some time to be able to catch up or complete their school assignments. So I think that marks the end of my presentation. So thank you very much for giving us this opportunity to present what we've been seeing in Wajir. And I'm handing it over to Dr. Wangila.
Wow. I guess that's an applaud, Eva, that you people would require quite some awesome work that has been done there, and especially with this marginalized area, Wajir, and with the very vulnerable of that society, who are the women and girls. And of course, in this case, we are talking about the adolescents. I've been following up so keenly, and a very interesting scenario about what these girls will be going through, and especially that we are dealing with pastoralists. So I'm considering a few other things that have come up, how, this household work really is impacting on the young girls. I was just thinking and looking at some of the things that you have mentioned here about marriage, pregnancy, and enrollment. And I was asking myself then, in the very end, because we are actually dealing with the very present. And I was looking at, in the very end, what would be the case scenario if this enrollment goes up? How would the completion rates of schooling be? How would their performance be, and how would it vary if we were to reduce this domestic works? And of course, much later, would want to know how did it even impact in their very, character, even after completion of school, probably they are married and what have you. So this is a very interesting finding, very interesting scenario. And so I would want to open room to members to, if you have any observations, any comments, and we move on. Anyone who would wish to go first? What has been your learning, and what would you recommend? Members, anyone who wants to go, maybe you can proceed. Yes. Anyone who wishes to move? I hope I was being heard. Yes, Marion.
Okay,
you can go on.
Okay, good afternoon. Good afternoon, everyone. Thank you so much for the presentation, Eva. I mean, I think it's quite insightful what the presentation and the findings of the RCT were. I have a couple of questions. And so the first one, I'll ask three, connected questions. I think the first one, I would just like to know why you selected cash transfers as the treatment in the RCT. Why was it not another form of treatment? So what was the decision behind the selection of the cash transfers? And then second, related to that, why did you make it conditional? Yeah, because I think there have been studies that have shown that conditionalities, when you put conditionalities first, it comes from a place of patriarchy, not patriarchy, a place of domination, thinking that these people do not know what they want, or they do not want maybe education, and so we have to put a condition on them for them to go to school, for instance. And then second, also, we know that sometimes when you have conditionalities, you're already burdening a burdened group, yeah? So in the case of girls, case of girls, maybe sometimes they do not go to school because of distance, because of other factors that could be familial. And so when we put the burden again of conditionalities, we say you have to do this to get this, we're already putting a burden on top of a burdened people. So what's your thought about that? And then the last one I would ask is, I think when you talk about unpaid work, we're talking about redistribution, yeah? So if for the girls, the work lessened in terms of the work that they were performing lessened. Who did the work go to? Because it clearly went to somebody else. Did it go to another woman, or how was it redistributed within the household? Thank you.
Okay.
Thank you very much. That is Marin. We can take another one before Eva could respond, if there is. Any other comments? Okay. So Eva, maybe you can respond to that.
Sure.
But we do not have an alarm.
Yeah, sure. Thank you, Marion, for those very good questions. So I think the first question was around why we selected the cash transfers as the treatment. So I think this was based on other studies that had already been conducted in similar settings, especially the results around showing that cash transfers in such a setting do drive quite a number of factors, including education. Yeah. So this is a context, for example, where already cash transfers are being disbursed through national programs like the Hunger and Safety Net program. So basically the decision to implement or test a cash transfer was based on the fact that a lot of literature at the time was showing that cash transfers were one of the interventions that really work when it comes to improving not just education outcomes, but other kind of general outcomes for adolescents, and particularly young adolescents. However, at the time when we started, what we were grappling with was there was the whole hype around multi-sectoral and interventions, but there wasn't enough evidence to show what combination of multi-sectoral interventions really work. So cash transfers, for example, by themselves have been tested, do work, have been proven to work. But when we talk about like multi-sectoral interventions, it wasn't very clear. For example, if you matched cash transfers with what other package does it provide like maximum benefits for adolescent and young people? So I hope I answer your question about like the cash transfers and the reason why we selected the cash transfers. So basically it was based on existing evidence that they work, but additionally we wanted to layer them on with other kind of multi-sectoral interventions to try and understand which package of interventions has maximum benefits for girls. And then in terms of why we make it conditional, why we made it conditional was also just pegged on literature at the time around conditional cash transfers vis-a-vis unconditional cash transfers, but also from earlier on discussions with the county government at that point, they felt that because this was a very highly pastoralist community, and things have changed in the recent years, they are not like as highly pastoral as they were back then. Then it would it might not like gain the benefits that we intended for it to gain, especially because of the fact that when drought comes, then there's a high likelihood that these girls will be moved to go and look after animals and pasture away from the home and away from the school. And therefore, from the county discussions, the leadership in the county felt that conditioning the cash transfer might help a little when it comes to things around retention and encouraging the family to be able to retain that particular girl to come to school and attend school, and not just come to school, but also attend school. And then in terms of like other factors, yes, we acknowledge that there are other factors, for example, like distance, as you've mentioned, that could impact negatively on these girls going to school. So we tried as much as possible to also follow up the girls who had not been to school and really try to understand deeply what were these factors that were making them not enroll in school. And something that has come up in our research in Wajir is that as much as it's a cash poor setting, the economic burden is not the biggest factors that prevents, for example, girls from attaining their education. So there are other factors which are very cultural, particularly in terms of like allocation of roles and responsibilities when compared to issues around the economic burden of schooling. So you find that even as recently as last year when we were testing for Scale Up, most of the evidence that was coming from this community is that the biggest thing that deters girls from joining school or attaining their educational goals is actually the burden of looking after animals, because predominantly it's a burden that is allocated to girls in the family. So when you compare that to the issue of economics, then it's more around the burden of household chores that is preventing the girls from attaining education more than the economics themselves. And what we've seen is that once you get the girl to school, because in this context, the issue mostly is not school dropout, but it's more around girls are not entering or starting school in the first place. But we've seen that once you get the girl to school and they enroll in school, there is a high chance that they will be retained in school and complete. So the household cash transfer again helps to boost that fast entry into school in terms of like helping them to cater for the cost of uniform, for example. But after that, once the girl is in school, then the retention rate is very, very high. So in terms of like redistribution, we didn't, our program never tested any kind of like redistribution of work. That is just a proposition that we feel like if we take care of the gender norms within the community and create advocacy around the value for girls' education, that there are impacts of burdening girls with household responsibilities that make them not to attain all these other goals in their life, then it's possible for communities to come up with ways of overcoming this burden of work. And hoping that in the conversations, then the redistribution is not redistributed to women, but rather to equally to both boys and girls. And I think for a context like Wajir, I think we've struggled with that a lot. Because what happens is, even as recently as the 2023 data we are seeing, in every household, there's a girl that is selected to be the animal carer. So even if there is a push and even if there is change in gender norms, the communities are accepting and understanding more and more the value for girls' education and are taking their girls to school. But there's always this one girl that has to be sacrificed to take care of the animals so that the other girls in the household can be able to go to school. And I think like you have a valid concern, and we have also like been having the same challenges, trying to really understand what are some of the strategies that could be implemented. And I know like from the county conversations, one of the things they've continually said is, for example, using the cash transfers to be able to pay someone to take care of the animals on behalf of the household, so that all the girls then are able to be taken to school. So I don't know whether I've answered all your questions. I hope I didn't miss any of them.
All right, I think you have done that. There were 3 questions. One was on cash transfers, and you said that is upon, you based it on existing evidence. And then, of course, the conditionality or the domineering aspect, and you have handled it quite well. I don't know, maybe we can ask Mariam, you think you have any other question, or you're comfortable with that? There was also an issue on distribution of responsibilities. Mariam?
Yes, thank you, Chair. Yes, Eva has answered the question sufficiently. Thank you.
All right. Is there any other person? Helen Apila, you can go ahead.
Thank you very much for that presentation. First of all, I'd like to appreciate the fact that the investment in the whole process is quite longitudinal, and it allows the study to run for a longer period of time. I think my question is about whether you also took an interest to study the sustainability of the program. For example, the whole aspect around incentives and cash transfers in the event that if it's an externally funded program, then how did you have conversations around the sustainability of these initiatives?
Yes.
I can answer that.
So, Eva, kindly go ahead.
Okay. Yes. So thank you so much, Helen. So yes, and that's why in between 2022 and 2023, we've been trying to test for scale up with the county government, and our whole rationale of testing for scale up is to look at how this kind of a program would perform if it was being implemented through government and through government existing structures. So just to answer your question around sustainability, so what has been happening in the when we were testing for scale up is that we had to revise some of those interventions for them to be interventions that the government feels comfortable to be able to implement and scale up if external funding was not there. And one of the things that we've done is, for example, the interventions now are being executed through the health department at the county level. And one of the things they discussed at the county why they wanted it to be executed through the county level is because through the health department, is because, for example, when it comes to safe spaces and the community conversation groups, then the health department has structures all the way to the community level. So at the moment, what's happening is the safe spaces, the community conversation groups are run by the community health volunteers or promoters, as they are now called. And then the community conversation group are facilitated by the community health assistants who already are on a government payroll, already, for example, hold dialogues in the community when they are talking about health. So the only thing they've had to do is sort of like in their conversations, beyond their conversations around health, they've brought in the components of talking about girls and all these negative impacts, like those of unpaid care work or any other kind of negative things that are impacting the girls in their communities. So that way there is sustainability, just because now the program is being run within existing county government structure. So the only piece that has been challenging has actually been the cash transfers, which has heavily still remained with us. So as much as the schools in the community, as much as the community health volunteers work together to, for example, understand school enrollment for girls, we've remained as the partner who's been disbursing these cash transfers. But we are currently in discussions with the county government to try and understand from a county perspective, what would be a sustainable mechanism to be able to disburse cash transfers to this kind of cohort of young adolescent girls. And I think that's also the piece where the county feels is less sustainable and more complicated for a county government to be able to implement. So what they advised last year is for us to test a second model where we replace the cash transfer with community projects, so community incentives. So the community would be given a target of enrolling girls in school. Once they meet the target, then they will be eligible to be given, for example, 1 million shillings in form of a project that they select themselves. And the county feels this is a more sustainable model because we've tested it. It had very similar results with those of the cash transfers. So they feel as a county government, this is a more sustainable way of giving incentives to the community because the government always builds infrastructure. So the only thing they need to do is peg the infrastructure on enrollment, for example, of girls. And those are some of the ways we've been looking at how sustainable this program could be.
Right. So that is information from Eva. I want to believe, Attila, you are okay with that, unless you have another question.
Right? I'm okay, thank you.
Thank you. And maybe even as we are moving forward, I was just wondering whether there's any organization among us that is doing anything close to what Eva has reported, and probably whether there is any benchmarking on the same, or you want to relate with what their findings are. I can see Madam Sarah Nduta, your hand is up, but meanwhile, even as you come to ask, there's one thing I was wondering while we were getting this from Eva, you know, while you were coming up with these interventions, what were the major conflicts that emerged? Yes, Sarah, you can go ahead.
Thank you. I also had a question as to comment for Eva. And first is to thank her so much and the team for preparing such an informative presentation and for undertaking the work across so many years and giving us the learnings. So when I look at the study setting and from the findings, of course, we see culture and how strongly it comes out and how it continues to dictate and derail, what we can do, how we can do it, and even what we can become. It speaks to, one of the recommendations that you gave with regards to norm shift work and there's been lots of conversations on, testing and piloting interventions that can enable us to shift norms towards, economic empowerment and placing women, at the center and at the front of, benefiting from many of the interventions that we are running. So I'm just wondering if, post this or even as part of this, you've thought about maybe perhaps piloting an intervention or even coming up with tools that, can help address that. And also, secondly, I know the study, looked at school attendance, and I was wondering whether beyond school attendance and through the data that you are collecting on the different time points, whether you are able to document, perspectives around performance. Beyond the girls being able to now continuously attend school, irrespective of the unpaid care work that they are faced with, was there a difference over time with regards to their performance? Did the study get to that point? I would just be keenly interested to hear around that. Thank you.
Thank you, Sarah. That is on tools to address some of those issues and, of course, performance and, of course, the conflicts. Yes.
Yeah. Thanks, Sarah. Yes. So to the question around like the major conflicts or challenges we experience, we've experienced so many challenges. I think we can write like a whole book on that. 8 years investment like gives you quite a number of challenges, but also like very great successes. I think one of the biggest challenge has been the challenge around shifting gender norms and shifting how communities really think about girls. And what we realized was it's not an easy job. There is always resistance, especially in a context where culture is so dominant, where it's a patriarchal society, basically. So shifting that narrative and investing time and energy to sensitize, create advocacy, and resensitize this kind of communities until they reach to a place where they say, yes, we acknowledge that we now think the girls need to go to school and girls need to be treated differently. So I think it's something that came at a big cost for us, because then it meant we had to pour a lot of financial resources in a county like Wajir that is really, really vast. And for us to be able to work in about 79 80 villages, that was quite a huge investment, because culture is not something you break in a day. So we really had to go out of our way to spend quite some immense amount of time to be able to do that. The other thing was it wasn't really easy to bring the county government on board to reach a place where they're able now to take this up as their program and run it as government. And I know, like in many spaces, we always talk about conducting evidence generation and research with the purpose of government taking it up and scaling it up. But our lesson has been scale up is not an easy road. Scale up is not also a one-day job, because it's taken us 8 years for us to be able to test for scale up. So I would say those are some of the challenges, but one of the other challenges that was at the community level was tracking the out of school girls, because these were girls that had already been married, mostly had already been married at an early age. So even for them to get back to school was really, really challenging. But we really wanted them to benefit from the other components of the program, even if they were not able to go back to school. We really wanted them, for example, to benefit from the safe spaces and the life skill groups and the financial literacy groups. So we really had to go the extra mile to invest in tracking them, so that whenever there are sessions, or as much as possible, we would cater for their costs to come from the herding places and come back like when the sessions were being held, so that they are able to attend these kind of sessions. In terms of like the other question around tools, so we've developed quite a number of tools, but I would say most of them are geared towards reduction of child marriage and not necessarily the issue around the burden of unpaid care work. So maybe that is something we can think about in terms of like from our learnings, maybe what are some of the tools we could be able to develop. But we do have a number of curriculums that came up that were developed because of this project. But mainly they are tools that are geared towards issues around the life skills and the sexual reproductive health and the financial literacy and building economic power for young adolescents. So yes, we do have quite a number of curriculums in that space that will be of help to adopt when it comes to especially the issue around economic empowerment for young adolescents. In terms of like school attendance and documenting performance, so yes, we were able to document performance for the girls over time, over the years we have spent there. And we do have like findings around literacy scores and numeracy scores particularly. But we also take it with a pinch of salt, because as much as there is what we would call low quality of education in Wajir, I think the issues are bigger. They're just beyond the girls. They're just beyond this pastoral life. They are also more to do with the systems and structures, the lack of adequate teachers, and other bigger systemic challenges. But yes, we do have the results around like their performance over the years we have been tracking them.
Thank you very much. I would want to follow up on something else, even as we wait to see whether there's somebody else who has a question, even as we finalize on what has come out. Now, while the enrollment went up, I mean, there's always that normal distribution curve. I would expect that, you know, as enrollment goes up, you would definitely expect a few dropouts. I don't know whether in your study you are able to come up with any dropouts, and at what point were the dropouts, and what would have really been, you know, the reasons behind the dropouts, so that even as the next course of, you know, fact finding comes through to give way for solutions, this would be an aspect that would be checked on, even as we think about this unpaid care work, I mean, domestic work. And then also maybe apart from the dropouts and the reasons why they're dropouts, I was also thinking, because there are those people who are responsible for distribution of those chores. Yeah, there's a person who in the family gives responsibilities to that young girl to go and take care of the animals. And of course, after sensitization, this has changed. Now, what would be the impact to such a person? And in future, does it still come to impact on this young girl, even after she gets out of school? I don't know whether that was also looked at. Thank you.
Okay. Yeah, so maybe starting with your last question, we didn't look at that. But what we've seen, like we didn't look at the responsibility of these people who redistribute the household chores. but we've looked at the power dynamics of who is the main decision maker in the lives of these kind of girls. And I think I will just comment on something, and then I will ask Daniel Osuka, who's also in this meeting, and Ruth to maybe add on this. But we've looked at, for example, who wields the power in making decisions or critical decisions around who takes care of animals at the household level. And we've tried to target those kind of people who mostly are apparently most of them actually were the mothers. So it was very interesting to see that in a society that is very patriarchal, when you look at how the children perceive who is the one who decides who in the family is going to take care of animals, then yes, a huge percentage was fathers, but the greater percentage was actually mothers. So what we tried to do is bring into the community conversation groups as many parents as possible, so that we are able to create the advocacy and the education around like why they need to rethink about this kind of things that are impacting negatively on the girls' lives. And then in terms of like enrollment, yes, we did experience some dropouts, but not as many in the context of Wajir. And very interesting, as I mentioned, is like consistently our findings have shown in these two randomized control trial, the original one and the one where we were testing for scale up, that once you get the girl to school, the probability of the girl dropping out is almost at 1%, for example. So very, very minimal girls did drop out, but for the ones who dropped out, mostly it was because of early marriage. And yeah, mostly because of early marriage, and also because of this burden of taking care of animals, particularly in the drought periods. But very minimal fallout within the number of years we've worked there. And we've tried to understand these also by looking at national data sets like the Kenya Demographic Data Set, the Kenya Demographic Health Survey of 2022, and other kind of national data sets. And we see the pattern is the same. For Wajir, once the girl gets into school, the retention rate is very high. But the biggest challenge remains getting the girl to school in the first place. Maybe I think
very interesting.
Osuka or Ruth. I can ask Osuka or Ruth if they have anything to add on that.
Yeah, just
All right.
if you allow me, Chair. Yeah, what Eva said is true. At some point, we realized some girls will drop out, say in term 1, but then come back to schooling in term 2. So like there was that variation. You'll see someone come in school in term 1, and then you look at their data in term 2, they are not in school, and then they come back in term 3. So there was such kind of variations in enrollment. That's something I would like to add. Yeah.
Yeah, that would be also very interesting finding, the variation that comes along with the same, and why would they go and come back? I'm sure maybe there could be reasons for that. So as we finish, we are supposed to have come up to 3:30. Maybe we'll take a last one from Patricia Macau, and then after that, I'll be taking the meeting back to Sarah. Patricia?
Thanks, Daktari. Just a quick one. Yeah, and good job. I think that was a timely study. And sorry, I came in a bit late. I might have missed some of the key issues, maybe highlighted. But one question is around the resources that they used. Are they accredited? Are they approved? Who approved them? Are they available for other users to use them? Like the literacy, the life skills materials that they were using. Then the other bit is around male engagement. I'd like to hear more about whether you had an aspect of male engagement in that project. And also, I'd like to get the perspective, because it's a pastoralist community. And I know in most cases, because of drought and so forth, you find it's the boys who are going far away with the animals to look for pasture and water and everything. Did that emerge as an issue that also boys are missing out of school? And what was the scale and what was the take, or from the findings, from your implementation or from your findings, what is the situation around also boys engagement and participating in school based on the naturalist nature?
Okay. So in terms of like the resources, yes, our resources were adopted and went through like rigorous processes, especially with adaptation led by, for example, the Ministry of Health, the Ministry of Education. So we did collaboratively develop them and contextualize them, and have been contextualizing them further as the years progress. They are available on our website. We could always send some links after the meeting. And yes, we do allow people to adopt them if they feel that whatever content is there is adaptable to the work they are doing. The only caveat we always have is, as long as you acknowledge us that you adopted it from us, that's fine. In terms of male engagement, the only way we engaged male was through the community conversation groups, because we understood that these were the holders of culture at the community level, and therefore the community conversation groups by themselves were dominantly attended by male in the community, different kinds of male, including the leaders in the community, including parents and all other kinds of male at the community level. But also there were women attending those community conversation groups, so that together they could be able to discuss about the challenges facing girls. In terms of the boys, so because it was a girls program, we didn't really focus our attention on tracking the boys. However, at some time points, in some of the phases, we did collect attendance data and enrollment data for boys. And what we've consistently seen, unlike other pastoralist settings, for example, like Turkana, where the boys are the herders, Wajir, it's actually the big men and the girls, the young girls. So the boys who are of school going age are given priority to attain their education. But when drought comes, it's the fathers and the girls that have to move in search of water and pasture. So from the evidence we've been seeing, we see very high rates in all the villages we go to, very, very high rates of boys being in school, including like recently, I think we were even like doubtful of the data until we had to reconfirm it. I don't know how many times, because it was showing us that 99% of the boys were in school. So I think because of just those dynamics of, in this particular setting, it's the role of the girl to take care of the animals and also go to search for pasture and water as the boy remains in school.
Thank you very much. That is very informative. And members, yes, the conversation could continue. I am certain that quite a number of things have emerged, including the sustainability of what has been done so far. Because for me, I'm looking at a scenario where beyond these 5 years, what next? Then, of course, the dropout issues, and then we had challenges, the completion rates, there was the issue of domination, and of course, the cash transfers. Many emerging issues have come in, even as Eva, you have managed to arrest all of them through your feedbacks. Thank you very much. I have been your host, your lead for this particular session, and I want to believe we have learned from each other, quite a number of intuitives that have come out. And so I would wish to take this meeting back to you, Sarah, maybe if you have a parting shot before we can close.
Thank you so much, Dr. Wangila, our chair for the TWG and moderator for this session. As always, you've done awesomely in coordinating us and getting us to engage in discussing the findings from this particular study. So I would like to thank all of us members for attending this session. It was such a great session. I think we really engaged and interacted with the findings. We've asked questions and made comments that I'm sure even the team will think beyond to how they can continue to position how girls are being impacted by unpaid care and how they can continue to improve their education attendance and even outcomes. So we do hope that you can continue to, keep the conversation alive even beyond the session. We have recorded the session, so we will be sharing that recording with all the members who missed the session. A number of them sent apologies because they had, intervening issues. So I would like to acknowledge all of you, especially for the very great questions that you asked. I know that we had planned for this session to run until 3:30, but we are way beyond that time for staying in and for listening in and continuing with the conversation. Thanks so much, Eva, Usuka, and Ruth. We are greatly indebted to you. We especially appreciate you for preparing the session, the slide deck, and even writing a blog, about this particular intervention that you have been implementing, which we will be sharing with the broader VCOP members later today. So we would like to really thank you, and we hope that you can continue to engage and to learn from, all the different work, pieces of work that we are all doing and the lessons that we are doing to basically amplify the place for girls and women around economic empowerment. So without further much ado, I would like to really wish you a very great evening. We will continue to engage on email. If you have any outstanding questions or comments for Eva, please do send them through me, and then we can continue to engage. Thank you so much, everyone.
Thank you. Bye.
Thank you.
Thank you and bye.
Thank you. Bye.
Okay, thank you. Bye.
Thank you, Sarah.